So the next talk will be on optical biometry. Well, IOL power calculation formulas and biometers have been evolving and evolving really fast over the past decade or so. So why optical biometer? The main advantage of optical biometer over conventional technique or over ultrasound is it is extremely repeatable, and another major advantage is it can be delegated. You don't need a greatly skilled technician to do optical biometer, and the results in between scans or between one technician and the other is more or less predictable and reliable. Another advantage is the level of accuracy is much high and the results are far more predictable. However, optical biometric immersion scan, when it is done by an experienced good technician, can give reasonably good results provided it is not a very long eye or a short eye. Axial length between approximately 20 to 24 will give reasonably good values with our immersion scan. However, for short and long, these are not ideal, and for post refractive surgery eyes and for irregular corneas. Another major advantage is it is not just axial length that is important or needed to give good values post biometry. You need a whole other information which includes AC depth, corneal thickness, posterior decay, white to white, lens thickness. This helps us to assess the effective lens position. Formulas have undergone a rapid change ever since they started incorporating the concept of effective lens position, or position where the lens is going to sit for that particular patient. It's a small video in the lens meter. We are moving a plus 20 diopter lens slightly up and down, and you can see as we move the lens up and down, the power in the lens meter keeps changing. So this is nothing but ELP, or effective lens position. And what is surprising is, for our patients in the category of axial length 22 to 24, the power variation in fact is more significant. And for myopic eyes, the power variation is not much. For a axial length of 22 diameters, an ACD error of just 0.25 will cause a power difference of about 0.4. So for these patients, the position where the lens is going to sit is very important in order to predict exact values. Swept source biometers of late are slowly taking over the previous generation biometers. Few advantages which the swept source biometer gives is, one is the telecentric keratometry, which is available with the Zeiss system. In other words, what mainly it does is, if the patient's head is slightly decentered or tilted slightly front or back, the equipment does not give false values. It has an internal normogram where it adjusts the values and gives fairly reasonable results. The number of points where the data is obtained for our swept source biometer is high compared to the previous generation biometers. This also does extrapolation, but the number of points tested in these equipment is far higher. So the extrapolation actually does happen, but it is on a much lesser scale than the conventional equipments. Another major advantage is this actually estimates the true K, or the keratometry value of the particular cornea, with, as I said, with less extrapolation. So these are particularly important in corneas which are not regular, previously treated corneas, post keratoplasty eyes, and most importantly post refractive surgery eyes. Previously, a couple of years back, it was still believed that Barrett's calculator was giving equally good values, but courtesy the current generation formulas, which include the Kane and the Hill RBF, the true K gives slightly more precise, better results than previous calculators. Another advantage is central topography, which was discussed 2 days back in Dr. Adith's IC. So another advantage is you can have a rough estimate or a glimpse of any irregularities in the cornea. In the Zeiss system, we get only the central topography. With the Antirion and Atlas and other biometers, in addition to central topography, in one shot you get topography up to, I think, around 8 mm. So that also will be able to screen irregular corneas. Maybe we can diagnose PMDs and the ectasias not in the visual axis or in the pupillary area. The third advantage is this equipment has an inbuilt OCT scan, which helps us to ensure that the value is taken exactly from the foveal pit, and it gives far more precise results, and we don't go to the parafoveal area and get irregular values. and we will also be able to catch subtle macular pathologies with the OCT scan, and we'll be able to convey to the patient and give us better results. Previously, any patient with a grade 3 or grade 4 nuclear sclerosis, dense PSC, mature cataracts, these biometers were not able to penetrate. But the SST biometers are able to penetrate even through dense cataracts and give fairly good values. The previous generation biometers had big change. They were measuring the anterior surface of the cornea using reflectivity. Because of that, when there are irregularities in the cornea, it gives false K values. With the swept source based system, actually the measurement is not done with reflectivity, it is done with swept source imaging. So maybe the tear film, role of tear film may get negated. As of now, there is not much data available to prove this. With evolution and with time, maybe the effect of tear film may get negated. There was a study which compared, however, there was a study which compared results between the Zeiss IOL master and the Anterion system. There was not much variation available. Both are equally precise, gives good values. The reason why changes happen between keratometers is each equipment does take K values at different areas of the cornea. So what I would like to say is, if you are using an immersion biometer, it is not ideal to take values from the manual K from the IOL master and put it into the system, because the immersion system or the contact A scan is meant for values from 3.2 mm zone. If data is taken from a topographer, SIM-K has to be taken. You cannot take data taken from the 1.7 mm zone or 1 mm zone, put into the A scan system. We will end up with wrong values. Change is always a constant. Biometry keeps evolving. Biometry is no longer a luxury but a basic and a necessary tool. Thank you so much.